So we're back with Transgynecology, and I'm going to be going over chapter 3 and 4. I'm going to try something a little bit different. I'm going to run off the cusp this time instead of using notes. So bear with me. So the first thing that I noticed about both of these chapters is just the increased use of case studies, and I fucking love that. So for chapter 3, the title is What Do Trans People Expect from Transition and What Do They Encounter Physically? And I really appreciated the insights in this. It really feels like people who are on the ground and in it have a fucking clue what's going on. So they talk about individual motivations and having a wide range of intentions, be somebody who's binary trans or somebody who's non-binary. They talk a lot about meeting transgender and gender non-binary patients where they are. Big fucking fan of that. Hello, hi. They also specifically name that patients come with all manner of underlying emotions, beliefs, and fears. And they use case studies to showcase that, which I really find helpful. They also are really leading the gynecologists to take a step forward with curiosity, which I super appreciate, and far beyond pronouns, which is nice. So we're moving beyond the 101. Thank you. So an example being, let's say a patient is coming in and the gynecologist might ask, is there something you need to tell me? So this is an open-ended question from a place of kind of not knowing and allows the patient to decide about disclosure. So these kind of things, they make such a big difference. So I love seeing that highlighted here. They also point out that an experienced and trans-competent gynecologist would know that a significant percentage of GI people with a neovagina experience sexual dysfunction. And that's something that I certainly see in my work with post-genital bottom surgery scar care, is that there's a wide range, hugely wide range. And I would say that in my limited experience with trans women or folks that have had vaginoplasty, that there's a lot of unspoken concern, unspoken fears, unspoken, just being able to name, they use the word dysfunction here, I don't care for that word, but being able to name not being able to access themselves in the ways that they want, in the ways that they desire. And I love that that's being named, not as something that should be assumed, but as something that should be noted as a high probability. So where I have seen that deviate is with my trans femme clients who are sex workers. I find that there's a notable difference in trans femme vaginoplasty clients who have been or are sex workers, and use their vaginas in ways that are part of their livelihood. And there's expectations and need and purpose behind engagement there that we don't always see with folks who maybe aren't using their bodies in that way. And especially another difference is if somebody has ongoing partners already versus somebody who doesn't. So that I have found, and in my experience, makes a huge difference. So they really, like I said, they really doubled down on case studies in this one. And I love that the primary case study for chapter 3 in particular, the patient is neurodiverse. The gynecologist is sex positive, which I got to tell you, I don't feel like I've ever had a sex positive gynecologist as far as I could tell. And I've had many, because I moved around so much. Also, the gynecologist in this case study is very playful. So I love that they showcase that. and very inviting of that. They also meet their client where they are in their neurodivergence. They do something that I do a lot of, which is using hand signals, because finding our verbiage in these moments can really be a barrier, and allowing people to have other ways to communicate can make a huge difference. So being able to see that in a textbook for gynecologists, I was like, fuck to the yeah, that's gorgeous. So the other thing about case studies in this chapter is they encourage solo play coaching. Hello, welcome to my world. I was so thrilled to see that. I think that it's certainly something I've not encountered with a gynecologist, but I'd be fucking delighted if I did. So that was pretty awesome. The gynecologist is teaching in a way, and encouraging and supporting, meeting the client where they are at, and noting where they want to be. So a lot of these case studies really hit the mark for me in regards to the post-surgical pleasure care that I do, that it's not just about the scar care, it's about finding your pleasure. It's about mapping where your body is, where the sensations are, where your desires are, and going after them. So that was beautiful to see. Let's see, they encourage sexual fantasies and lingering with the pleasure. This made my heart happy. So they also talk a lot about trans men and having often never set foot in a gynecologist's office, or very little, or often has been many, many years, and the needs that come with that, having never been, and being excited about this experience from a trans feminine space, versus needing this access and being very fearful, which of course those overlap and swirl together, but broad brushstrokes. So let's see. I also appreciated that they noted that it's not uncommon for trans men to believe that once their menses has stopped, that they are no longer fertile and that they can't become pregnant. And I've seen this online, and every time my heart kind of stops and my gut just drops, and I'm like, oh, we don't understand our bodies. Okay, cool, great. So they name that in here, which is great. And they talk about like how to initiate these conversations. And how intimidating that can be. So they also name the ongoing erasure that happens with trans masculinity. It's something that I'm keenly aware of these days, and the rejection, and the repetition of rejection, and what that can do to our mental and emotional state. So as I was reading this chapter, I took this book with me to my doctor's appointment a couple days ago, and I actually bought him a copy, but it hasn't arrived yet. So I like waved it in front of him, and I was like, I'll bring you a copy in a minute. But I noticed there was a shift when I checked in, and I don't know when it happened, but instead of saying sex, it says sex de naissance, which is like sex at birth. And I really appreciate that little tiny difference, because a lot of this book is talking about those first initial steps. So oftentimes a gynecologist won't even realize that a trans person has walked away from them because of their wait staff, because of the first phone call, because of how they were treated when they walked into the fucking waiting room. And that's really named here, about the importance of those first interactions. So, yeah. So establishing a policy of trans inclusion for office, and specifically providing staff training around trans people, beyond just the gynecologist itself. So I deeply appreciated that. They also, named that the insertion of a speculum can be traumatic. It can be very painful, especially people on testosterone. So, and I love that they tell the gynecologist how we develop our own language to describe our genital components, and that the gynecologist, the provider, should adapt the practice of asking each individual trans-identified patient if they have terminology they prefer. So moving beyond names and pronouns, but terminology specifically. And they literally say, like, write it at the top of the chart so you don't forget. That these things they're really fucking important. So I think that's beautiful, tending and caretaking. So, let's see, what else? I love that they say trans people know who they are, irrespective how unusual or mysterious they may appear to others. So allowing the person to lead, which is much of the basis of all of my work, from somatic gendering to erotic coaching, is that my client is the expert on their body. They are leading each and every session, and I'm merely a guide and support. So they're really circling around that in this book, which I appreciate. So they also name transgynecology as the ungendered version of the gynecological field, which I just thought was a really sweet framing. So they also name that trans people offer all of society the opportunity to do away with objectifying stereotypes, which, my heart soars. I really believe strongly in the ability and shape-shifting of trans, non-binary, two-spirit, and intersex people to showcase the breaking down of sexism and gender stereotypes to allow for a different way moving forward. So that's the bulk of chapter 3, and I thought it was fucking gorgeous. So chapter 4 is a pondering trans female gynecologist. So this was written by Rosemary Jones, and it's a trans female gynecologist. And I gotta say, like, this chapter felt like a love letter. It really did. I had so many moments. I was reading this as I was sitting in my doctor's office waiting room, and I would just close the book and kind of stare into space, like, I was like surrounded by gay men who are like, that one's standing out. But so Dr. Jones had written an article, a case study in 1976. And so she's revisiting this case study, 50 years later, right? So she was born in 1938, and then she wrote this case study in 1976, which it seems like the case study had a lot to do with her own life experience. And one thing that she points out to start is that in adolescence, this is a time when in a child's life when sympathetic discussion and effective support can be life-saving. And this is pointing to the too many trans people, especially trans youth, that we've lost, and noticing that the incidence of more than 40% of suicide and parasuicidal ideation still remains the modern statistic, unfortunately, so many years later. So this chapter was fascinating in a historical and now sort of modernized viewpoint, kind of a blending of the two. It felt like a time folding over itself in a way that really struck me. So she points to a lot of historical context in which, if you're not steeped in not even trans history, but just LGB history, history, you might not know. And I can forget that sometimes, that we don't always know this history, because I really was steeped in it for so long. But I love that she threaded that throughout the whole thing, saying that, being gay was understandable, if still illegal, but gender dysphoria was a mystery. So even as people were coming to a place of understanding difference in sexuality, the laws had not caught up to that. And gender dysphoria was way beyond that. And I remember when I came out in 2001, I had a discussion with a trans woman at a bar one night, and she said to me, well, it's not as though trans people belong within the sexuality diversity, like we're something different. And I said, but don't you think that there's a blending to be had there, and a cross section in which we can support and love one another in our differences? And she really felt strongly that this was a separate thing. And at the time, I was primarily passing as male, and I was kind of shocked, because it, as somebody who is AFAB and dating dominantly women at the time, it hadn't dawned on me to see these things as separate. So, oh, well, the fun part about that conversation was she told me that trans didn't belong in the alphabet, and bisexual wasn't a thing at all, which I was. And I was like, I think we are agreeing to disagree on any of these fronts. But as I was 19 at the time. I did not have the framing context, nor certainly the vocabulary to be able to articulate myself. And I remember being really frustrated without a sense of knowing how to connect in that debate, if you will. So anyway, the context of this chapter and 4 really brought up a lot of my own personal history in that way. So she talks about the internet having revolutionized the understanding of the predicaments of transness, and that the initial response to a patient is all important, which I certainly agree with, more than not. It can make or break what could be a vital and fruitful relationship. I definitely agree. When I went to my first doctor's appointment, once I had immigrated to Canada, the doctor was brand new, wet behind the ears, and I remember him talking about, oh, okay, you're trans. And I was like, no, for simplification, I'll use the term non-binary. I don't really identify with either of these terms, and I still don't, but I will use them interchangeably. But, and I remember him very purposely putting down his pen and going, oh, I am new to that, and I may make mistakes. Do you feel like you can correct me if I do? Because I really want to understand. And that just really touched my heart. And I was like, that's all we can ask for. That's beautiful. Yes. And as I started talking to him, he was like, do you mind if I Google? Which I just like, so darling. And now that we've been together years later, and I'm in this body, and I'm walking up to him like, oh, I'm bringing you a copy of this book. It really is about building a fruitful professional relationship. It really can be. So I loved being able to read that here. So she also reminds gynecologists, and I quote, don't forget that you are in the company of a gender expert. And if I could still cry, testosterone makes that kind of hard these days, but if I could still cry, I would have, reading that quote in particular, because I was like, to the fuck yeah. Yep. Thank you. That's awesome. I really appreciate that honoring. So, she goes into the kind of psychological conditions and understandings that can be, I think, often associated with the ways in which we're showing up in the world. And I think she holds those with great care. So she also notes that the concept of the obligatory binary has been consigned to history. And that was beautiful to read, that like, this is a thing that is going. And for me personally, when I see that, I see the like crushing up and breaking apart of sexism. That is my hope and desire for the world out of all of this. So, I also love her humanization of herself. She says, one of my earlier repetitive errors was to persistently inquire as to when the patient is going to have the surgery, and naming those errors for herself as an example to other gynecologists to not make this misstep, I think is really beautiful. I was lucky enough to be able to tell my doctor, like, oh, I just want to play with testosterone. Not everybody gets to do that. When I had my top surgery, I needed a psych note, and I was in California at the time, and went to see the psych who was specifically a gender specialist. And I remember kind of steeling myself and preparing my conversation to be like, I actually want this for my back, and my GP has told me that this will be easier via a gender thing since I do gender fuckery anyway. So I need a note from you. And I was trying to figure out, like, how do I convey that in a way that feels ethical to my heart and also gets me what I fucking need to get this surgery. And thankfully the psychologist kind of stopped me and was like, I just want a name that, like, if you just want to have this because you want to have this, that's fine. Let's just talk about that. And I was able to kind of come into that conversation with more directness, I think. And do I wish and want that for everybody, you know, whether you want to be on the binary and cis passing, or you want to be some crazy amalgamation. Hello. And I think all of us should be able to have that access. So I love that she's allowing for a lot of that to be gooey. So, yeah. She goes into a lot of the kind of hard stuff around Trans Day of Remembrance and increase in reported murders over the years, and the violence that especially our trans sisters and especially our Black trans sisters are facing. And um, she doesn't go into as much the power dynamics, but she's more talking about the history and its implications today. So the intersectionality has been really threaded through in the first two chapters for sure. So that was nice to know that that was carrying through the book. She tells the gynecologist to be careful and note that what we have to say about our history and the conflicts that we've experienced, that we are global experts on our own situation, which I love because I often have clients, or clients before their clients. I do free exploratory call if you want to schedule that at any time. And often people will ask me, like, oh, like, what are we going to do? And it's a really hard question, because I start with saying, well, you are the expert on your body, whether you know the information or not, it is available to you. And so what we're going to do is we're going to get playful, we're going to explore, and we're going to find things together. So this feels really in line with that, is that the client really needs to feel empowered, and she makes a big point of that. So she also says, and I really like this quote, we doctors are sometimes hostilely regarded as gatekeepers. Don't we know that? Power dynamics. But reassure the client that gatekeepers often open gates as well as close them. And I have been sitting with that quote in particular for the last several days. So love that. I also appreciate that she names that especially trans folks can be really enthusiastic about having our levels done and our blood tests, because it's less invasive than so many other procedures that we're looking at. We're like, yes, please take the blood, that's simple, compared to a lot of other ways in which we need to be poked and prodded and examined. So she names that as being something that is accessible, more likely to be accessible to us, and also that there are other needs and how to approach us with that. So I think that was beautiful. I've got little hearts that I've highlighted throughout this chapter. Like I said, I really felt like it was more of a a love letter than anything else. So yeah. Let's see. What else? Yeah, I think that's the bulk of it. So I'm already rolling into. I'm excited about chapter 5, but I shall pause and make you wait because that's looking really good. So, okay, that's what I've got for chapter 3 and 4. Let me know if you have questions. I'm happy to dig back in and let you know what I think or what I find or whatnot. This first copy of this book got to me really quickly, and the second copy has taken like a fuck longer to get here. I was able to find it for under $100, so just FYI, it is out there. So yeah, all right, love y'all. Bye.